Assalamu alaikum. I am Dr. Asma Hosna, Associate Professor, Department of Pathology, Bashundhara Ad-din Medical College. Dear student, welcome to you all today's pathology session. Today I am going to discuss about the endocrine system. At first, we have to know what are the major glands of endocrine system. The endocrine system is consist of pineal body, hypothalamus, pituitary, thyroid, parathyroid gland, adrenal gland, the pancreas, the reproductive organ, ovaries and testes. And among these glands, I am going to discuss broadly about the thyroid gland. At first, we have to know the anatomy of the thyroid gland. The thyroid gland is a ductless alveolar gland found in the anterior neck, just below the laryngeal prominence, that is called Adam's apple. It is roughly butterfly shaped with two lobes wrapping around the trachea and connected in the middle by an isthmus. The thyroid gland is not usually palpable. What about the physiology of the thyroid gland? The thyroid gland produces the hormone, that is thyroxine and triiodothyronine, which regulate metabolic body process, cellular respiration, total energy expenditure, growth and maturation of tissue, and turnover of hormones, substrate and vitamins. Now, how the thyroid hormones are regulated? The secretion of the thyroid hormone, that means T3 and the T4, is controlled by trophic factor, which is secreted by both the hypothalamus and the anterior pituitary. When there is a decreases level of T3 and the T4, that stimulate release of thyrotropin releasing hormone from the hypothalamus and thyroid stimulating hormone from the anterior pituitary, and that causing the T3 and the T4 level to rise. And so elevated T3 and the T4 level in turn feedback to suppress the secretion of both thyrotropin releasing hormone and the thyroid stimulating hormone. Now come to the topics, the disease of the thyroid gland, which is very much important for our pathology sector. You have to know the disease of the thyroid gland. The disease of the thyroid gland included thyrotoxicosis, that means hyperthyroidism, hypothyroidism, which include cretinism and the myxedema, thyroiditis, that means Hashimoto thyroiditis, subacute granulomatous thyroiditis, subacute lymphocytic thyroiditis, and the Graves' disease. Goiter, diffuse and non-toxic goiter, multinodular goiter, and the tumor include adenomas and the other benign tumor and the malignant tumor, and there are also some congenital anomalies. Now, what about the hyperthyroidism? Thyrotoxicosis is a hypermetabolic state that is caused by elevated level of free T3 and the T4, because it is caused most commonly by hyperfunction of the thyroid gland. It is referred to as hyperthyroidism. What are the causes of thyrotoxicosis? The thyrotoxicosis associated with hyperthyroidism can be classified into primary and the secondary group, and in the primary group include Graves' disease, toxic multinodular goiter, toxic adenoma, hyperfunctioning thyroid carcinoma, iodine-induced hyperthyroidism, neonatal thyrotoxicosis associated with maternal Graves' disease. And the secondary causes include thyroid stimulating hormone secreting pituitary adenoma. And there are also some non-associated with hyperthyroidism, subacute granulomatous thyroiditis, subacute lymphocytic thyroiditis, stroma ovary. There are many causes about the thyrotoxicosis or hyperthyroidism, but there are most common important causes are that you have to know, that is Graves' disease, hyperfunctional multinodular goiter, and the hyperfunctional thyroid adenoma. Now come, what are the clinical manifestation of hyperthyroidism or thyrotoxicosis? As the thyrotoxicosis or hyperthyroidism is a hypermetabolic state, and so there are overactivity of the sympathetic nervous system. And so there are various virial system manifestation. In cardiac manifestation, patient may present with tachycardia, palpitation, arrhythmia, cardiomegaly. And due to the higher level of calorigenesis, heat intolerance and the sweating, and high catabolic metabolism result in the weight loss. Now come, how can we diagnose a case of hyperthyroidism? The measurement of the serum thyroid stimulating hormone level provides the most useful single screening test for hyperthyroidism. A low thyroid stimulating hormone value is usually confirmed with the measurement of free T4 and which is expectedly increases. Now come to our next topics, that is hypothyroidism. What is hypothyroidism? Hypothyroidism means that decrease the level of T3 and the T4 level, and which is caused by structural or functional derangement that interfere with the production of adequate level of thyroid hormone. Hypothyroidism is any structural or functional defect of thyroid gland causing reduces production of thyroid hormone. It is nearly 10-fold more common in women than the men. And the disorder is divided into primary, secondary and the tertiary group. The primary group include developmental thyroid hormone resistance syndrome, post-ablative surgery, radioiodine therapy, autoimmune hypothyroidism that included Hashimoto thyroiditis, iodine deficiency, drugs like lithium iodides, congenital biosynthetic defect. Secondary causes include pituitary failure and the tertiary causes include hypothalamic failure. What about cretinism? It refers to the hypothyroidism that develops in infancy or early childhood. And the myxedema, it refers to hypothyroidism developing in the older child or adult. Now, how we diagnose a case of hypothyroidism? We should measure the serum thyroid stimulating hormone level that provides the most important useful screening test for diagnosis of hypothyroidism. And the thyroid stimulating hormone value is increased in primary hypothyroidism, and the T4 level are decreased in the patient with hypothyroidism of any origin. That's all about today's lectures, my dear student. Inshallah, see you again in our next class. Till then, Allah Hafiz.